Well, the nation's largest school district returns to class today as pediatric COVID cases continue to surge across the U.S. Roughly 1 million students across New York City are back in the classroom this morning, many for the first time in over a year. Kids will have to wear masks at all times, and all teachers and staff will soon have to be vaccinated. This comes as the Delta variant, of course, is running rampant in regions with lower vaccine rates. Natalie Duddridge from CBSN New York reports.
Some Upper West Side kids spent their last day of summer vacation at the playground and water park. This seventh grader not quite ready to go back to class yet.
Homework, more homework, work, more work, a lot of stuff, yeah.
But this first grader can't wait.
I miss playing with my friends in the playground and play with the toys.
These parents are concerned about school safety. Dozens marched outside City Hall calling for a remote learning option.
My son is, he has asthma, he has an overactive immune disorder, and putting him into a building where I know it's overcrowded and I know that the ventilation is questionable is not an option for me.
There's no remote option for students this year, but if a child has a serious medical condition, they can apply for home instruction with a teacher 1 hour a day. These parents say it's not enough. They want a virtual choice.
It should at the very least be provided to children under the age of 12 like him who cannot be vaccinated yet.
Officials say all school buildings have been equipped with new air filtration systems and will be constantly disinfected. Students must wear masks and there will be bi-weekly COVID testing in every school. Those participating in select extracurricular activities considered higher risk like choir, band, and contact sports must get vaccinated. And while vaccines aren't mandatory for students, they are for teachers, with rare exceptions for medical or religious reasons. This parent says she's comfortable with the protocols.
I'm glad that they're going back and they're opening up the way they are. They belong in a school setting. At home, it's been difficult for everyone.
So far, the owner of Jasmine's Caribbean Cuisine says she hasn't experienced resistance from customers.
Everyone wants to be safe right now, of course, because of the Delta, and they know what's going on. So people have been very cooperative. And whoever doesn't want to, who's not vaccinated, they'll sit outside.
Businesses that don't comply will first face a warning and then fines start at $1,000. Officials say there will be vaccine sites set up at every school during the first week of class, but in order to get the shot, students must have parents' approval. On the Upper West Side, Natalie Duddridge, CBS 2 News.
All right, to talk more about this, let us bring in Dr. Amesh Adalja. He's an infectious diseases expert and senior scholar at Johns Hopkins University Bloomberg School of Public Health. Thank you so much for joining us, Doctor. So kids are back in school. In a lot of areas across the country. Pediatric COVID-19 cases have spiked in parts of the country in recent weeks, and at one point accounted for a quarter of all new infections. So I know kind of the good part of this story is kids still are not really affected the way adults are. Still, we're seeing more kids infected, more kids ending up in the hospital. That's just the way the numbers go. Could we be seeing or heading towards another peak now, now that kids are in the classroom and, you know, the case numbers are going up?
Kids are getting infected, not necessarily at school, but schools are getting kind of impacted by the community transmission that's going on where they're located. So when you look at schools, that's not necessarily the issue. It's that community transmission is so high, and then testing occurs, cases are recognized in schools. But I do think that schools have the tools to be able to conduct in-person classroom teaching safely. They even had those tools before the vaccine. Now it's even easier with teachers being able to be vaccinated and those above the age of 12 being vaccinated and using social distancing and protocols. So hopefully we won't see this happen, but the only way it won't happen is if school districts and superintendents have the flexibility to be able to use all the tools at their hand, especially if they have a large swath of unvaccinated students and if the community itself is being hit hard with the Delta variant.
So what concerns do you have for children heading back to school, particularly those who are under 12 who are not yet vaccinated?
So it's important to remember that children are spared from severe consequences of disease. And for someone less than the age of 12, this is going to be on par with influenza or RSV for them. It's different with older children, but for younger children, they tend to be the least likely to have any kind of severe complication. So in the sense of their health, it's not as much of a worry. But what I do worry about is disruptions occurring when there are cases because of very strict quarantine and isolation rules. And I think we've got to get schools doing better with testing so they don't have to quarantine an entire classroom, that they can really limit to those people who are at risk and make it as least disruptive as possible. We have to really learn how to use everything that we have now in 2021 to keep kids safe, to keep schools operating, because we know that kids really suffered for the last two school years because of the way adults kind of handled COVID-19. And I think we have to get it right, because another school year lost is going to be unacceptable. And there's no excuse for it now. We know how to do this, and we have to actually do it.
Yeah. So the FDA said on Friday that it's working around the clock to get a vaccine available for younger children, those under 12. What's the criteria for approving a shot for children under 12? And when can we anticipate, do you think, that a vaccine would be made available?
We need to see the data from the clinical trials, because children are not little adults, especially when you're getting into those lower age groups. So we want to see how effective is the vaccine in that age group. How safe is it? Are there side effects very similar? What are the rates, for example, of myocarditis? And I think we want to just do the risk-benefit calculation for that age group. And maybe we'll see some of this data late September, October, but it's going to be some time. But it's important that we get this right, because we want people to have confidence in the vaccine when it is approved for that age group of 5 to 11.
So far, only 25 states have fully vaccinated at least half of their population. Are we just at this point, Doctor, going to have to realize and deal with the fact that it will no longer be considered a pandemic, but endemic? In other words, that we just live with COVID-19, and for those folks who are not vaccinated, they are at risk in all the ways that we have talked about. And for those of us who are vaccinated, if we receive our boosters, we can more or less continue to live our lives in a normal fashion, just understanding that there will be people we may come into contact with who are not vaccinated.
That's likely to be the case. And from the very start, I've been someone who said that COVID-19 was going to become an endemic respiratory virus because it wasn't something that could be eliminated or eradicated. And the goal was to make it like other respiratory viruses that we deal with year in and year out by vaccinating high-risk people so that we had cases, but they were decoupled from hospitalizations and deaths, and we didn't see hospitals in crisis. We are now hitting that wall where there are some individuals who will not be vaccinated under any circumstances. And I think we are kind of in a two-track world where those who are vaccinated, those who have immunity from prior infection, are able to kind of go about their lives pretty normally, whereas individuals who are not immune are going to be a place where the virus continues to spread. And that's something that's had kind of a geographical separation in the United States, where you look at these southern states where this is primarily happening, they're going to have a hard time really ever recovering from COVID-19. It's going to be something that is a major disruptor in their lives there, whereas other places that are more highly vaccinated, more highly immune, are going to be able to go back to some semblance of their normal life and realize that if they do get a breakthrough infection because they come into contact with somebody who's infected, that breakthrough infection is going to be generally mild and not require medical attention. And I think that's a success. But I do think it's unfortunate, because what's going on now in the South, for example, is self-inflicted. This is willful. These are people shunning this vaccine on purpose. And I think that's not something we thought we would have to deal with at this stage of the pandemic. We thought that people would be able to see the safety, efficacy of this vaccine and basically be lining up in droves to get it, and we would have this pandemic in our rearview mirror.
So then, the question, Doctor, is how do we get over this hump, right? And mandates is one way to do it. You heard the president come out pretty forcefully saying that the vaccine is going to be mandated for federal employees. Anyone who wants to do contract work with the federal government is going to have to make sure their employees are vaccinated, saying that businesses with over more than 100 employees should have, should tell their employees to get the vaccination or undergo regular testing. I'm curious about your take on mandates. Is it something that's necessary? Is it something that should happen across the board, or perhaps only in certain industries where people are more vulnerable?
When it comes to the president's plan, there are many parts of it that I completely agree with. I do think federal workers, federal contractors, and hospitals that participate in Medicare need to have their workforces vaccinated. I think it gets a little tricky with his regulations regarding OSHA and companies with greater than 100 individuals working there. I've been somebody who's advocated from the beginning that private businesses require vaccination as a condition of employment, things that, for example, United Airlines have done. I think it gets a little bit hard and difficult from a legal standpoint, and also from a pushback standpoint when you kind of mandate it through OSHA. I wish it didn't have to come to that. I think it's a good thing. Everybody should be getting vaccinated, and companies should have done this long before the president intervened. But I think it's going to be a battle, and it may end up creating a lot more acrimony over the vaccine. But I do think in general, the idea of getting the population as vaccinated as possible and getting your workforce and your workplace as safe as possible by getting vaccination, that's something we all need to be working towards.
Doctor, I like the fact that you said that children are not little adults. Do you mind if I pass that along to my brand new 5th grader? Because I don't quite think she's going to take it from me. But if a doctor says so, perhaps she will believe it.
All right, go ahead.
Thank you.
We love
All
it.
right,
Thank you,
doctor.
Doctor.
Thank you.
Appreciate it.